Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener, and welcome back to the Wellness Optimizing Warrior MD podcast. The next couple of episodes will be dedicated to uterine cancer. Why a few episodes? It's just the uterine cancer. It's just one condition. Well, because even though it's not a very frequent cancer, it is a very important cancer to get diagnosed because we can diagnose it and treat it early. And it's one of the most treatable cancers of the female pelvic organs. So this podcast episode series about uterine cancer is going to focus on educating you about the diagnosis of uterine cancer, and this is what this episode is about, the top 10 symptoms that might warn you that you have uterine cancer. And it would also focus on prevention of uterine cancer. So I'm not going to give you a lecture about types of uterine cancer and how to treat it. I will also not talk about uterine cancer treatment, as I am not an oncologist or actively involved in uterine cancer treatments, because I'm just a regular gynecologist. That would be a GYN oncologist. So my interest is in educating you, my listener, and provide you with enough facts. So you are now armed with information on how to diagnose and suspect uterine cancer early and how to possibly prevent it. The main problem with all cancers, actually most cancers, not necessarily all cancers, is that they are picked up and detected and diagnosed when it's too late. Best example is pancreatic cancer. One of the good things about uterine cancer is that it is usually highly symptomatic and presents with some very clear signs and symptoms, giving us, the doctors, and you, the patient, a clear warning that something is happening and we need to look into it. Uterine cancer, also known as endometrial cancer, usually presents with some very clear early warning signs. And if recognized promptly, they can lead to the very early detection and obviously much better treatment outcomes. So let's talk about the top 10 reasonably early signs of uterine cancer that women should be aware of. Number 1 is abnormal vaginal bleeding. This is one of the most common, very early signs of uterine cancer. Abnormal vaginal bleeding. This can include bleeding between periods, very prolonged or heavy periods, bleeding after menopause, or any other unusual bleeding patterns. I'm going to remind you that any bleeding that is not normal will be abnormal. So bleeding in between your periods or 2 times a month is not normal. Bleeding heavily and painfully month after month and for long periods of time is definitely not normal. Last but not least, any bleeding that happens 12 months or more after you stopped menstruating naturally, it is not normal. You are not getting back your periods. Instead, you most likely have some problem with your uterus that needs to be investigated. Obviously, it could be a cervix, it could be other things, but your uterus is the number one reason why you would bleed abnormally after menopause. I did talk more about abnormal bleeding in my previous episodes about adenomyosis and uterine fibroids, so please go back there if you have any questions about what abnormal vaginal bleeding is. And if you're not sure, just go see your doctor. They will either reassure you and tell you it's normal, they'll do a test, tell you it's normal, or they will pick up something abnormal. Number 2, pelvic pain or pressure. Any persistent pelvic pain or pressure unrelated to menstruation or a clear-cut known cause can be a symptom of uterine cancer. The growth of uterine tumors inside the uterus can cause cramping and the sensation of pelvic pressure. Remember, your uterine cavity is not a real cavity, it's a virtual cavity. And every time is distended by an abnormal growth, like a cancer or a polyp, this can be felt as pain in the pelvic area, the lower abdomen, or the lower back. So number 1, abnormal bleeding. Number 2, pelvic or lower abdominal pain. Number 3, abnormal vaginal discharge. Unusual vaginal discharge that may be watery, slightly bloody watery, or just mainly watery but tinged with blood, can be a warning sign of uterine cancer. Keep in mind any discharge that is abnormal in color, consistency, or odor should be always evaluated by a healthcare provider. And sometimes, again, you might not be sure if it's normal or not normal. So please err on the side of caution and seek professional evaluation of any abnormal vaginal discharge. Number 4, painful intercourse. Women with uterine cancer may experience pain or discomfort during sexual intercourse. This symptom specifically can indicate the presence of a very serious gynecological condition, including uterine cancer. Please know that when the uterus is being constantly touched and moved around during intercourse, if it has a diseased process like adenomyosis, fibroids, polyps, or cancer, it will cause pelvic pain or lower abdominal pain during, after, or during and after sex. Adjusting your position during intercourse to avoid feeling the pain and not going to the doctor simply delays your diagnosis. So please, anytime you have painful intercourse, discuss having a full evaluation and an ultrasound with your gynecologist, especially as you might develop pelvic pain with sex after menopause. Number 5 is unexplained weight loss. Significant and unexplained weight loss without changes in diet or exercise habits can and will be an early sign of a serious underlying health issue or a cancer, obviously including possibly uterine cancer. So please keep in mind weight loss should be monitored and reported to a healthcare provider if it occurs unexpectedly and without a clear-cut explanation. Number 6, the feeling of fullness in the pelvis sometimes is perceived as bloating. Keep in mind some women with uterine cancer may experience a persistent sensation of fullness or bloating in the pelvic area. This sensation can be accompanied by other symptoms like pelvic pain or bleeding, maybe even significant changes in bowel habits like constipation or diarrhea. Please do not ignore this weird, unclear sensation. If it's persistent and is bothersome, it is time for you to see a doctor. Number 7, fatigue. Now, chronic fatigue or unexplained tiredness that persists despite adequate rest can be a symptom of various health conditions, including uterine cancer. Now, fatigue may also be accompanied by some of the symptoms described above. That is even more worrisome and needs to be investigated. Please do not blame fatigue on your age as you get older. I'm approaching 60 and I'm up sunrise and keep going without coffee all the way until 9 p.m. when I actually conk out. I do feel I am a very young, late 50s, and obviously using pellet hormone therapy is helping me keep up my energy. But I do hear this a lot from many women. Well, yes, doctor, I'm tired, but isn't that normal as I get older? No, it is not normal to be tired just because you are older. Please do not blame fatigue on your age. Fatigue is a sign and symptom of something. Look into it and make sure it's not a sign of a developing cancer. Number 8, unexplained changes in bowel habits. Women with uterine cancer may experience changes in bowel habits, constipation, diarrhea, or very noticeable changes in the stool consistency. These changes, especially when combined with other symptoms, should always be evaluated by a healthcare provider. Obviously, changes in bowel habits are usually a hallmark of a colorectal cancer, but in some circumstances, especially if the uterine cancer has been silent and has spread beyond the uterus, it could actually tell you there's a problem because it has affected surrounding organs. And this brings me to number 9, swelling or enlargement of the abdomen. In some cases, uterine cancer can cause swelling or enlargement of the abdomen, which can be due either to the presence of a very large tumor or a fluid accumulation in the abdominal cavity, which is called ascites. If your belly gets large for no apparent reason, you need to be evaluated, and a simple ultrasound can tell you what's going on. Last but not least, number 10, anemia. Any cancer, but specifically uterine cancer, can lead to chronic blood loss that results in anemia, especially when a woman develops those abnormal bleeding patterns we talked about and she ignores them and does not seek care. Symptoms of anemia would include weakness, fatigue, pale skin, shortness of breath, and dizziness. Any anemia should be investigated by a healthcare provider to determine the underlying cause. What is more serious for a woman is that any anemia in the absence of bleeding after menopause should be concerning and should prompt a serious investigation for possible cancer or a nutritional deficiency, which can be caused by colorectal problems and intestinal issues. So to sum it up, there are 10 signs and symptoms that might warn you have uterine cancer: bleeding, pain, abnormal vaginal discharge, painful intercourse, unexplained weight loss, the sensation of fullness in the pelvis or persistent bloating, fatigue, changes in bowel habits, swelling or enlargement of the abdomen, and anemia. It is important for women to pay attention to their bodies and promptly report unusual and especially persistent symptoms to their doctor. I have talked about this in a previous episode, but I think it deserves a special place in this episode as well. I believe women are by definition and by instinct caretakers. So they literally take care of everyone else around them, which unfortunately makes them ignore themselves or makes them put themselves last on the list of priority of caretaking. What you should remember, though, when you experience signs and symptoms and you're like, okay, I'll make an appointment, yeah, I'll get to it, is that when you get sick, and if you get sick, then you will not be able to take care of anyone else. And now your family will have to take care of you. Keep in mind, early detection of uterine cancer can greatly improve treatment outcome and prognosis. So if any of these warning signs I discussed are present, it is essential to seek further evaluation, including a physical examination, imaging tests, and possibly a biopsy to determine the cause of these symptoms. Regular gynecological checkups and screenings can also aid in the early detection of uterine cancer and other gynecological conditions. Keep in mind, most cancers, unfortunately, do not present with any symptoms. However, they can be detected and picked up with the simple performance of a pelvic ultrasound during your woman wellness checkup: cervical cancer, uterine cancer, ovarian cancer. Please be your own advocate and ask to have a pelvic ultrasound with every annual checkup after the age of 50. Well, you should ask, why is that not standard of care? Well, because for public health reasons, transvaginal ultrasound is not considered cost-effective as a screening tool for early detection of uterine cancer. However, public health and cost-effectiveness should not be your concern. Your concern should be, how can you get the best care? Even if your insurance company will not cover the ultrasound, the approved in-network cost for an ultrasound is under $150. Most imaging centers and doctors' offices charge under $200 to do an ultrasound if you have no insurance. It is very affordable and cost-effective. This brings me to talking about uterine cancer diagnosis. Usually, uterine cancer is diagnosed through a series of steps that involve clinical evaluation, imaging tests, and sometimes a biopsy. So let's talk about the diagnostic process for uterine cancer and the steps it might include. Number one, a medical examination and a physical examination. This is always the initial step in diagnosing any type of cancer, and specifically uterine cancer. And it involves a very thorough review of the patient's medical history, presenting symptoms, after which the healthcare provider will conduct a physical examination, including a pelvic exam, to check for any abnormalities of the vagina, the cervix, the uterus, the ovaries, and the surrounding tissues. Number two, we have the ability to perform imaging tests. And these can be ordered to evaluate the uterus and the surrounding tissues and structures for signs of cancer. The most common imaging tests used in the diagnosis of cancer include a transvaginal ultrasound, an MRI, or a computed tomography, a CT scan. Let's talk about the transvaginal ultrasound. The ultrasound uses an echo, ultrasound waves. There's no radiation, and it's very easy to do. The transvaginal ultrasound, even abdominal ultrasound, can help visualize the uterus and detect abnormalities like tumors or abnormally thickened endometrial lining. Let's talk about this endometrial lining for a second. If you're not sure what it is, I described it in detail in my previous podcast episode. So please go back and listen to the podcast episode about the endometrial hyperplasia. What you want to know when your ultrasound is being done is the doctor seeing an abnormally thickened uterine lining. And what is an abnormally thickened uterine lining? Well, if you are menopausal and have not had a period in over 12 months, a natural period, and if you do not use any hormone replacement therapy with estrogen, then your normal uterine lining on an ultrasound should be 4 millimeters or less. Well, let's talk about a thickened uterine lining. A thickened uterine lining is very common in younger women who make plenty of estrogen. Remember, I talked in multiple episodes about how estrogen creates growth of the uterine lining every month, and then this lining sheds when your period comes. We, the providers, the doctors, do not care very much about how thick the lining is in a woman that is naturally menstruating. Usually, the thicker the lining, the more the estrogen exposure of that uterus. However, that might become important when we need to monitor fertility treatments and determine the best timing of IVF or intrauterine insemination. Or, as a physician, we can interpret the possibility of pathology if the ultrasound is done early in the menstrual cycle, right after a period, when the uterine lining is at its thinnest. What do I mean by that? Well, at the end of your period, your uterus should be thin inside. If it's thick, very thick, that's a very clear-cut indicator you either have endometrial hyperplasia or a polyp, and further investigation is needed. So the timing of the ultrasound is actually crucial, and your doctor should know and should not be sending you to have an ultrasound with an imaging center randomly. He or she should be very clear in instructing you to time the ultrasound with your period and have it scheduled at the end of your period. I tell all my patients when to do the ultrasound, when the best timing is, and I advise them, call us please on the first day of your period, and we will schedule your ultrasound towards the end of your period, and it doesn't matter if you're still bleeding. So let's talk about the uterine lining in other circumstances. What about when a woman uses estrogen and progesterone hormone replacement therapy after menopause? What is the normal uterine lining for that? Well, the interpretation of the uterine lining thickness has to be taken into context with the rest of the data. Is the woman using progesterone daily? Or is she using progesterone cyclically and allowing for shedding of the lining once a month? Well, it is generally accepted that if you are taking progesterone daily, then your lining should be no thicker than 7 to 8 millimeters. However, if you are taking progesterone cyclically, not daily, your ultrasound should be planned at the end of your monthly bleed, as I mentioned before. And your lining should also be no thicker than 7 to 8 millimeters. Again, that's always to be interpreted in the context of what is your estrogen level? Because if your estrogen level is 30 or under and your lining is persistently thicker and showing 7 millimeters or more, then it's probably something else. So everything needs to be taken in context, and it's really important your doctor looks at the big picture. Your lining, your age, what are your hormone levels? But again, if you have no hormones and you're postmenopause and you start bleeding and an ultrasound is done, your lining should be 4 millimeters or under to be safely interpreted as random bleeding, most likely benign. So the benefit of the transvaginal ultrasound is that it is very accessible, very quick, lasts about 10-15 minutes or under. It is very cheap and easy to do. There is no need for radiation or IV contrast. So it is very, very non-invasive. What about other diagnostic tests that can be done? Well, I mentioned MRI, the magnetic resonance imaging. It provides detailed images of the pelvic area and can also help determine the extent of the cancer and whether it has spread to nearby tissues. This is a test most likely will be ordered to help stage the cancer once the endometrial biopsy will be positive for cancer. The other diagnostic test that's very commonly ordered is a CT, a computed tomography scan. The CT scan may be used to also assess the spread of cancer outside the uterus and to identify possibly metastases in other organs. And it might be sometimes preferred over an MRI or required by the insurance company, as it is slightly less costly than an MRI. So this brings me to the gold standard method for diagnosing uterine cancer, and that is endometrial biopsy. To confirm a diagnosis of uterine cancer, a healthcare provider, usually a gynecologist, may need to perform an endometrial biopsy. During this procedure, a very small sample of tissue from the lining of the uterus, also called endometrium, is collected and examined under a microscope by a pathologist for the presence of cancer cells. This procedure can be performed in the gynecologist's office, and it literally takes under 10 minutes to perform. It is mildly uncomfortable and usually extremely well tolerated. There are also no specific restrictions for post-care, as the woman can immediately resume normal activities. Now, there are some patients in which this procedure is not that easy, and it could be very, very painful and quite traumatic. That is specifically when the surgical entrance to the uterus is closed by an inflammatory process or by previous scarring, or in some women, they have never given birth, or they have significant atrophy caused by the loss of estrogen, and also a significant shrinkage of the cervix. Now, fortunately, we do have medication available to make your cervix softer and amenable to the procedure of cervical dilatation, which means opening your cervix, the entrance to your uterus, by using small metallic dilators that are gradually introduced into your uterus from small to a little bigger, a little bigger. Now, the woman can also go under anesthesia if this process is way too painful and unable to be tolerated in the office. If that's the case and general anesthesia is required, the gynecologist will likely advise a hysteroscopy instead of a blind biopsy. What do I mean by a blind biopsy? Well, the endometrial biopsy is done by introducing a thin plastic tube into the uterus. It has a small opening at the top and some form of a suctioning device that will pull tissue into the tube. Multiple passes are needed, so the doctor introduces the tube and then extracts it while rotating it and activating the suction device. I did speak about that in the last episode as well. Again, the tube is rotated to allow sampling from all around the cavity, but the reality is that there is a pretty good possibility that the endometrial biopsy could come back negative, but it could be a false negative result. The best procedure that allows direct visualization of the entire uterine cavity and a directed biopsy of the visible lesion is actually called a hysteroscopy. The hysteroscopy is a procedure where we visually examine the inside of the uterus using a thin, lighted tube called a hysteroscope. This procedure allows for us to directly visualize the uterine cavity, will clearly aid in the diagnosis of any uterine abnormalities, including tumors, as well as allowing us to do directed biopsies of these abnormalities. Like I can see it on the screen, I'm going to go straight for it. And might also provide the ability to remove these abnormalities at the same time that we do the procedure, like a polyp or a fibroid. So more and more physicians are actually preferring to do a hysteroscopy rather than scheduling an endometrial biopsy because it is easy to do, well tolerated, even in the office, and it provides the ability to perform treatment at the same time. What else can be done and how else we can diagnose uterine cancer? Well, back in the old days, before endometrial biopsy in the office and before hysteroscopy, the gold standard was a DNC. And some patients in their 50s or 60s might have actually had DNCs when they were younger. The DNC stands for dilatation and curettage of the uterus, and it was usually recommended to collect a larger sample of tissue from the lining of the uterus for better and further testing. During a DNC, the cervix is dilated enough to introduce a uterine curette, which is a little sharp instrument that is used to scrape the uterine lining in multiple passes and then collect it for analysis to help confirm a diagnosis of some kind of uterine pathology, including uterine cancer. We don't do DNCs anymore. We actually use hysteroscopy and a visual DNC with a specific probe called MyoSure. Last but not least, we can do laboratory tests, blood tests. A specific blood test called CA-125 is actually a tumor marker, and it may be conducted to assess the risk or early development of uterine cancer. This test can also provide additional information, not just about the presence of the cancer, but about the progression or recurrence of the cancer. And it can be used to follow up the patient after the cancer treatment to see if it's recurring. And the last is staging and further evaluation. Obviously, if there's a diagnosis of uterine cancer, either by performing an endometrial biopsy or a hysteroscopy, or is suspected in an ultrasound, then staging tests may need to be performed to determine the extent of the cancer and whether it has spread to other parts of the body. This staging will help guide treatment decisions and prognosis, and it's usually done by a gynecology oncologist. So, as a summary and to close this episode, please remember it is very important for women experiencing signs and symptoms of uterine cancer, like abnormal bleeding, pelvic pain, painful intercourse, abnormal discharge, anemia, fatigue, bloating, etc., to seek prompt medical evaluation. Early detection and diagnosis of uterine cancer will lead to more effective treatment options and improved outcomes. Gynecology doctors play a key role in guiding patients through the diagnostic process, and the gynecology oncologists will help develop personalized treatment plans based on the individual's specific cancer diagnosis and stage. Join me next week when I talk about strategies for preventing uterine cancer. Until then, I wish you a wonderful week. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.